Today we will discuss hospital management challenges and strategies. Now, introduction. Not any system in the world is permanent. The only thing which is permanent is the word change. So change is necessary in every aspects including healthcare system. So all healthcare system should be changed in next 20 years. There are some factors which are responsible for change in the healthcare sectors, like latest advancement in diagnostic and therapeutic technology, molecular biology, which deals with parasitology, virology, genetic engineering means biotechnology and gene therapy, total quality management, which means quality standard accreditation is necessary for any healthcare sector nowadays. Total quality management is important for every sectors as well as health sectors also. Next is research and development, because research provides the avenue to utilize the resources properly. L- Next is ethical and legal issues. Knowledge regarding the laws and ethics regarding healthcare sector helps to understand the needs of change. Last but not the least is discovery and innovation in organ transplantation. It provides an improved medical care, so changes are required. Now is environment. An organization has to deal with two kinds of environment, internal and external. The organization's environment may include all the conditions which surround the organization and influence its functions. A successful organization has to find out the needs of the community and try to cope with the competing demands of the environment. If any organization fails to meet the need of the society, then it will not be possible for the organization to survive. The hospital has two types of environment, internal and external. Internal environment includes self, the process, the system, the specialized skill, the organizational structure, and the culture of the organization. External environment can be further subdivided into general and task environment. General environment includes socio-cultural, technological, and economical environments, and task environment means patients, competitors, suppliers, unions, all this. Next part is pressures for change. First is demographic. Nowadays, hospitals are facing challenges due to increasing cost of technology and the frequently changing needs of the community. In the community, the increased number of elderly population and disabilities may determine the hospital service utilization. The more will be the number, more will be the necessity of hospitalization. Because of nuclear family, home care for elderly and disabled persons is nearly impossible. Next is economic part. Medical care costs are increasing day by day, and it is serious concern for every country. The charge of institutional care is increasing every day in all countries. Administrative structure has been changed in New Zealand and UK to cope with the regular changes. They have created two groups, purchasers and providers. With changing needs, patients have also different expectations from the healthcare institutions. It's very natural as the needs of different patients are different. As the need of change is increasing nowadays, so the healthcare services has to develop new technologies frequently. Next is technological. Technological development depends upon the technology and the level of knowledge that are available. People can apply their knowledge and upgrade their skill to use the latest technology. Community will accept the technology and should have enough financial fund. Marketing of technology is important, and so that good marketing skill is required. Nowadays, home based care is very much important. So, advancement of technology is important for providing proper home based care. Good methods of management should be developed for the healthcare services. Diagnostic kits, new vaccines, laparoscopy, desktop analyzer, all these new technologies have reduced the hospitalization rate. Next is consumer choice. The patients can give the useful feedback regarding hospital services because the consumer of hospital service is patient. Satisfied patients are like assets for a hospital because they provide feedback which will be helpful for any hospitals. Because the word of mouth communication is very important for any service sector. Now, quality management. Main objectives of quality management are to understand the need of the consumer, to provide better quality of care, to maintain better quality of management. Total quality management is depending upon management philosophy which involves commitment from all departments and all levels of management of a hospital. In organization, all the departments should work in a way so that the continual improvement can be assured. The main objectives are customer centric approach, use of latest scientific approaches, regular improvement of process, participation from all departments. For providing better quality of care, development of clinical guidelines are important. There are some basic criteria for measuring quality, that is mortality rate of hospital, number of malpractice suits, total number of disciplinary actions taken against doctors, number of adverse events in the hospital, number of specialty available in the hospital means specialty care, the system of external evaluation, all this. And there are some methods which are used to measure the quality in healthcare. These are surgical audit, nursing audit, medical audit, quality circle. Next challenge is information technology. In recent life, information technology plays a vital role in everyone's life. It is also useful in our healthcare sector. Information technology creates revolution in every aspect of our life. Patient information is a vital for all healthcare sectors. So, use of information technology is important for any healthcare. A foolproof technological and managerial strategy should be developed so that relevant information can be shared timely and best quality of medical care can be assured. The strategy helps to provide clinical information, management information, confidentiality, and provide better services. The procedures of communication by the administrators are participation, delegation, listen, and giving and receiving feedback. Next is managing change. Change is the only constant. It provides and an improved environment. Administrators should work for developing strategies for change the environment for betterment and to solve the problems which are arising due to continuous change. There are some areas where changes are required. Knowledge regarding any subject, person's attitude, behavior of individual, behavior of group. Unique strategies involving several approaches to be developed for the changed situation. Resistance to change is not desired for anybody. It is a bad mindset. We have to remember change is happening in everybody's life and it is occurred in every second. So, change is the only constant in life. Now, conflict resolution. Conflict is in everywhere. It may be within an individual or maybe within in task group or personal group. There are different causes of conflict. In professional life, the main causes are personality differences, role interdependence, different personal values, specialized activity, scarcity of resources, conflicting goals, multitask role communication. Administrators can change the outcomes. It may be constructive or destructive. Behavior of the employees can help the conflict to be resolved or to be suppressed. A good manager should have the ability of conflict resolution constructively because in long run constructive conflict resolution can create a good organizational environment which will be conducive for the employees. A good administrator should have enough knowledge to manage and lead the people in proper way so that they will be the best workforce for any organization. Next challenge is managing time. Time is the most precious thing in the world. The time which is past that will not come back again. So, the best utilization of time is important for anybody. If time is not managed properly, nothing can be managed. So, we have to give concentration on proper utilization of time. There are some techniques of time management: personal commitment, focus and block distraction, deciding what should not be done, proper allocation of time, set the goals, completion of work, before due time, create everybody's routine, and managing people properly. Now, conflict resolution. Conflict is in everywhere. It may be within an individual or maybe within in task group or personal group. There are different causes of conflict. In professional life, the main causes are personality differences, role interdependence, different personal values, specialized activity, scarcity of resources, conflicting goals, multitask role communication. Administrators can change the outcomes. It may be constructive or destructive. Behavior of the employees can help the conflict to be resolved or to be suppressed. A good manager should have the ability of conflict resolution constructively, because in long run constructive conflict resolution can create a good organizational environment which will be conducive for the employees. A good administrator should have enough knowledge to manage and lead the people in proper way so that they will be the best workforce for any organization. Next is human resources development. In human resource, policies should be formulated by emphasizing on some factors. Job rotation to be planned so that core competency should be built up within the organization at all levels. As the environment is always changing in the organization, so it is necessary to develop standards and design and redesign the care process when necessary. The organization environment should be conducive for continuous learning. Autonomy and openness should be encouraged, which will help to generate value among employees. Proper leadership is necessary to motivate the employees and get good output from the employees. Ongoing education program to develop the efficiency of all the staff should be conducted by the organization. The organization should recruit right person for the right job to perform the job in better way. Now, managerial ethics. Nowadays, technologies are updating every day, and that is why resource allocation is creating an acute problem for any organization. So, ethical dilemma may take place. Though administration is totally practical oriented, but the administrators should have knowledge regarding theories and related principles to solve the daily problems. Administrators should have to deal carefully with all the problems which arise during daily work. One of the most important challenge is research and development. Research in healthcare sector is very much necessary as it provides huge knowledge regarding new technologies, health manpower, new policy and its analysis, which helps to define problems and to evaluate policy alternatives. Reduction of mortality rate, increased life expectancy, overall economic productivity and well being all are helpful to improve the health status of the society. Efficient delivery of healthcare is the most important objective of healthcare delivery because efficient delivery helps to reach the healthcare to all community people. Now is leadership and beyond. Proper management and good leadership helps to influence the professional behavior of the employees, means how they deal with superiors and colleagues. But the leaders should keep in mind that all the employees are different. So everybody should be treated in different way. In case of management, managers set goals. Goals can be long term or short term. Managers have to develop strategies to reach the goals which are set. At last, result should be evaluated. If the result is not desirable, then the plan should be altered and new goals should be set. Managers perform all managerial functions like planning, organizing, implementing, motivating, and evaluating the results. Managers should have a proper mix of technical, conceptual, and human skills. A manager should keep in mind that to motivate other people to achieve goals and strategies of organization is his primary responsibility. The main functions of leaders are to communicate, to motivate the followers to get the best outcome which will help to achieve the goals. Looking ahead, in the new era, managers should have multidisciplinary knowledge. They should have knowledge regarding all the happening topics. An administrator of a hospital should formulate policies which help the organization to reach the goals, should delegate the authorities to the right people, and must ensure the efficient and prompt healthcare delivery. While, while evolving plans, an administrator should keep in mind regarding current scenario and the needs of future. It's an administrator's responsibility to maintain a healthy relationship with the community people who are taking the services of the hospital. Hospital authority must identify their needs and they have to plan the service according to their needs.